Did you know that around 5.8 million Americans are living with Alzheimer's disease, a form of dementia? This number is expected to rise to 14 million by 2060. What's even more surprising is that some medications you might take every day could be speeding up this decline without you even knowing. Many people assume that prescription drugs are always safe, but that's not always true. Certain medications can silently harm your brain, increasing the risk of severe dementia over time. For example, studies have shown that long-term use of antidepressants can raise your risk of cognitive decline by a staggering 54%. In this article, we'll uncover the shocking truth about 6 common medications that may be causing serious damage to your brain. We'll explore how these drugs work, the risks involved, and most importantly, what you can do to protect your mental health. Stay tuned as we dive into the hidden dangers lurking in your medicine cabinet and discover strategies to help you live a long, healthy life without compromising your mind. Chapter 1: The Silent Brain Hijacker, Antidepressants. If you're taking antidepressants, you might feel like you're improving your mental health. But what if those very medications could also be chipping away at your memory? Many common antidepressants, especially SSRIs, selective serotonin reuptake inhibitors, like Prozac or Zoloft, could quietly be doing long-term damage to your brain. Research from Harvard Medical School found that long-term use of certain antidepressants has been linked to memory problems and cognitive decline. These medications affect your brain's serotonin levels, which are important for mood, but also for memory. When these levels are altered for too long, your brain may struggle to function properly in other areas. Tricyclic antidepressants, which are older but still prescribed, are even more dangerous. They block acetylcholine, a chemical crucial for learning and memory. Over time, the lack of acetylcholine may lead to the kinds of memory lapses we often associate with early dementia. In fact, one study published in JAMA Internal Medicine showed a 54% higher risk of dementia for people who use these drugs long-term. The key strategy here is to ask your doctor about alternatives. Newer treatments like cognitive behavioral therapy, CBT, have been proven to be just as effective as medications for many people, without the added risk to your brain. Reducing your medication dosage or switching to a safer alternative could lower your chances of cognitive decline in the future. Chapter 2: Over-the-counter? Over the line. Antihistamines. We've all reached for antihistamines when allergies strike, but that little pill might be causing more harm than you think. First-generation antihistamines, like Benadryl, are known for their drowsy side effects, but they can also affect your brain in surprising ways. These medications work by blocking histamine, a chemical responsible for allergic reactions, but they also block acetylcholine, that crucial brain chemical we talked about earlier. Without enough acetylcholine, your brain's ability to process and store memories weakens. It's like trying to write on a chalkboard without chalk. One study by the University of Washington found that long-term use of these drugs increased the risk of dementia by 79%. That's a huge number for something so commonly found in medicine cabinets. And the worst part is, many people use these drugs for sleep, thinking they're a safer alternative to prescription pills. If you rely on antihistamines regularly, it might be time to consider non-drug alternatives for allergies and sleep. Simple strategies like nasal rinses for allergy relief or melatonin for sleep are much safer options that don't come with the risk of dementia. Chapter 3: Blood Pressure Bombshell, Beta blockers. Managing high blood pressure is important for a long and healthy life. But what if the medication you're taking to protect your heart is hurting your brain? Beta blockers, a common treatment for high blood pressure, might be doing just that. Beta blockers, like propranolol and metoprolol, help your heart by reducing the effects of adrenaline. But here's where it gets tricky: they also reduce the blood flow to your brain. Over time, this reduced circulation can cause issues with memory and learning. A study published in Neurology found that people taking beta blockers had more brain shrinkage and memory problems than those taking other types of blood pressure medication. For people already at risk of dementia, this reduced brain blood flow can speed up cognitive decline. According to Dr. Elizabeth Roth from the New York Times, for older adults, the long-term use of beta blockers may trade one benefit, reduced heart disease, for another risk, cognitive impairment. The strategy here is not to stop your medication, but to talk to your doctor about adjusting your treatment. There are many other blood pressure medications, like ACE inhibitors or calcium channel blockers, that don't have the same risk for dementia. Plus, lifestyle changes like a healthy diet, regular exercise, and stress management can help control your blood pressure without the need for so many medications. If you found this information helpful, consider subscribing to our channel for more insights on health and wellness. Staying informed can help you make the best choices for your long-term health. Chapter 4, Gut Health, Brain Wealth. Anticholinergics and your microbiome. You've probably never thought of your digestive meds as a threat to your brain. Anticholinergics, often prescribed for bladder problems or irritable bowel syndrome, IBS, are commonly used but have a dark side. These medications work by blocking acetylcholine, yes, that key brain chemical again, to calm the muscles, but this also messes with your memory. Here's where it gets interesting: the gut-brain connection. Your gut and brain communicate constantly, and when something disrupts the gut, it impacts your brain too. Anticholinergics not only block acetylcholine but also interfere with your gut microbiome, which plays a crucial role in brain function. According to the Microbiome Solution by Dr. Robin Chutkan, a healthy gut is a healthy mind. This disruption could accelerate cognitive decline and even lead to dementia. A study published in BMJ found that people over 65 who took anticholinergics for over 3 years had a 50% higher chance of developing dementia. That's a big red flag. So, what's the strategy? If you're on these meds, talk to your doctor about alternatives like physical therapy for bladder issues or dietary changes for IBS. The fewer anticholinergics you take, the better off your brain will be. Chapter 5, The Insomnia Trap, Sleeping Pills and Memory Loss. We all know how vital sleep is, but relying on sleeping pills could come with a high cost. Prescription sleep aids like benzodiazepines, Valium, Xanax, and Z-drugs, Ambien, Lunesta, might give you a good night's rest, but they could also steal your memory in the long run. A shocking study from the British Medical Journal showed that using benzodiazepines for more than 3 months increases your dementia risk by up to 51%. These drugs slow down your central nervous system, helping you relax, but they also suppress important brain activity during sleep. Over time, this can impair memory consolidation, your brain's ability to store and recall information. The irony is that poor sleep is linked to cognitive decline, but so are the pills used to treat insomnia. It's a catch-22. The better approach? Focus on natural sleep strategies. Experts suggest practicing sleep hygiene, such as keeping a consistent bedtime, avoiding screens before bed, and creating a calming pre-sleep routine. Cognitive behavioral therapy for insomnia, CBTI, is also proven to work better than medications in the long run, with no risk to your memory. Chapter 6, Pain Reliever or Brain Deceiver? Opioids and cognitive decline. Opioids have become a major tool for managing chronic pain, but they come with severe risks. Beyond addiction, opioids like OxyContin, Vicodin, and morphine are now linked to cognitive impairment. Here's the scary part: opioid users are more likely to develop dementia than non-users, according to a study in the American Journal of Geriatric Psychiatry. These medications affect the brain's reward system, which, over time, can lead to damage in areas responsible for memory and decision-making. Prolonged opioid use can shrink brain volume, making it harder to process and retain information. The strategy here is clear: avoid long-term opioid use whenever possible. Pain management doesn't have to mean sacrificing your mental clarity. Non-opioid painkillers, like acetaminophen or NSAIDs, ibuprofen, come with fewer risks. If your pain is chronic, consider exploring non-drug therapies, such as acupuncture, physical therapy, or mindfulness meditation. In his book Healing Back Pain, Dr. John Sarno even suggests that some chronic pain can be linked to unresolved emotional issues, which can be treated with therapy instead of drugs. If you found value in this video, consider subscribing to our channel for more tips and strategies on protecting your brain health. Staying informed is your best defense against cognitive decline.